Ever find yourself explaining to people why your eyes are red and your nose is watering? I'm not sick, it's just allergies, you know, that
I've heard it, yeah. If you're looking for relief, you may find it over the counter. As we imagine better health, your options for some of the most common seasonal allergy symptoms.
From CHI Health Pharmacy Manager Bob Grenier. Good to see you, Bob.
Hi,
thanks for stopping
welcome.
Thanks for having me.
Yeah, you bet.
It's
You know,
great to be here.
we've had that conversation. You know, if somebody's, you think they're sick, but maybe it's just allergies. You got to really assess those symptoms. How do you assess the symptoms? What goes into that?
Well, what I typically try to do when somebody approaches me with a question is, you know, ask them, what specifically are your symptoms? Are you stuffy in the head? Do you have drainage? Are you itchy, watery eyes? So really kind of get a sense of what's really bothering them.
You dial into it. And,
Right.
And I think, as you would recommend, that matters when it comes to what you decide to choose, because you know some of these you could stand for hours and read all the boxes and spend tons of money and maybe not still feel like you got to the root of the problem. So let's say you are stuffed up and have headaches. Which direction would you point a patient then?
So if you're stuffed up and have headaches, the best thing to do is treat that with a decongestant, because what's really giving you the headache is all that congestion that's built up in your sinuses. So I treat that with a decongestant and then perhaps some Tylenol as well. And there's combination products where you can get those together. Otherwise, the other thing I try to do is ask people what they have at home. So they have something at home that's useful, like most people have Tylenol around. So I'll have them use that in combination with a decongestant.
What about these symptoms if they've lasted for a long time? Let's say a month, maybe longer. What do you recommend to those people?
So usually if they've lasted longer than a few weeks, or if their symptoms go away and keep returning, it's perhaps indicative of a bacterial sinus infection. So in those cases, I'd recommend that they see their primary care physician or go to an urgent care, because likely it's a sinus infection that would be needed to be treated by an antibiotic.
And maybe they think it is allergies, but it's not, right? Because sometimes
a
cold, it could look like something else, especially in the earlier stages.
Exactly, and sometimes people will get a cold or a viral illness, and they'll have it long enough and those symptoms will last long enough that it'll develop a bacterial infection as well. So I kind of try to talk to people and really get a sense of how long they've been experiencing the symptoms, what the severity is, those sorts of things, so I can make a good recommendation.
If it's a cold, do you have a recommendation? Is there anything that can be done for the common cold to, I guess, ease some of the symptoms a little bit maybe, huh?
Yeah, so there's some products out there that contain zinc, and there's been some research on zinc that if you take it early in the illness, so like right when you start to develop symptoms, and you use it for 3 days consistently, it does reduce the severity and the duration of the symptoms.
Like those, I've seen those drops.
Yep.
Like those, they're not cough drops, but they're like the
they're
zinc
called
drops.
coldies or zinc drops. Exactly. And those actually have been proven in studies to work.
You got to catch it early though.
Exactly. That's the key. You have to catch it early. If you're 3 or 4 days in, it's probably not going to help you very much.
Going back to seasonal allergies and the symptoms and sort of getting precise about what you're experiencing, why do you caution those that come into your pharmacies about not overdoing it? Because I'm kind of that person where I'm like, I'll just throw everything at it that way. I'll be great in no time. Why do you say if you don't have some of the stuff that's listed on the box, don't go there?
Right. So we call that the shotgun approach. So you can take a product that has everything in it and treat your symptoms with that.
Yeah.
But really when you look at that over-the-counter section that it contains cough and cold products, it's overwhelming. There's just a ton of stuff there. So really, I don't like to overtreat people with the shotgun approach. I like to really, again, get down to what's really bothering you. Do you need something for cough? Do you need something for congestion? And then tailor my recommendation to a product that treats just what they have.
So that you're not drowsy if you don't have to be.
Exactly.
You're not dried out if you don't have to be.
Yeah, and I always tell people, hey, this particular ingredient might make you sleepy, so make sure you don't take it during the day if you're at work or whatever. This product might keep you awake at night if you take it too late in the day. Those sorts of things that are practical, about the products that they're using.
Yeah, but heaven forbid we have to go see our doctor. There are some cases where you probably recommend them to go see a doctor, like if you have a fever. Should they go see the doctor if they have a fever at some point?
So sometimes viral illness will cause a fever, but usually it's a low-grade fever, and it usually doesn't last very long. If they've had a fever over 100 degrees, then usually it's indicative of perhaps a bacterial infection, or if they've had a fever for several days and they're just feeling, really bad, then I usually recommend that they see their physician.
I couldn't tell you the last time I asked a pharmacist about something over the counter, because you guys are always so busy. I'm like, I'll just read the box, I'll just stand here, I'll figure it out.
Oh no, I interrupt them. I'll take them because I have no idea what
We're
this
like
stuff
on
is.
both sides of the spectrum.
I'll walk up.
How do you answer this, where you've got some people who come in and wouldn't dare ask the question because they don't want to bug you? At what point should I be more like Mike?
Well, what I try to do, and when I'm behind the counter, is we really go out of our way to make us accessible to patients. And so, I always like proactively, if I see somebody sort of wandering around or staring at the shelf.
They've been there all day.
I'm always like, hey, is there something I can help you with? What are you looking for? And, really sort of proactively reach out to people that I think are struggling with, what to choose or, what to do.
Should patients or customers be afraid to ask the pharmacist about specific
absolutely
treatments?
not. One of the things I always do is thank people for asking me the question, because, just because it's over the counter doesn't mean it's, innocuous or not dangerous or, So I always like, to help people and then encourage them to ask the questions, because that's our training and that's our expertise.
Yeah.
Are there ever cases when we're talking about seasonal allergies or colds, that sort of thing, where those over-the-counter products can also impact some of your prescription medications
Well,
too?
absolutely, and that's one of the things too that I always talk to people about, because some of those products, if you have glaucoma or diabetes or high blood pressure, you'd want to make sure to avoid those. So I was also, ask them what else they're taking if I don't know the patient.
Sure.
So, because there are interactions with over-the-counter products.
Yeah, right, as you said, it's not just because they're over the counter doesn't
Exactly.
mean, I mean, they're designed to work.
Right.
And so they can still have other effects that you might not be aware of.
Right.
Yeah, Bob's just another one of the professionals we talk with, CHI Health, and you can go to their website with the /pharmacy right on the back side of the chihealth.com website.
All over the place. You've got like a lot to do.
Yeah, well, I get around a little bit.
Nice to have you here this morning.
Thank you very much. It's great to be here.
Thank you. Well, next.